Have you ever been awoken by the sound of your spouse maybe grinding at night? You hear these loud noises and it wakes you up at night. Yeah, many people do grind their teeth and they're not even aware of it. So there's some people, sometimes they come to the office and it would be the spouse that would actually notice that the person grinds at night. We are able to see it on the x-ray, or even looking in the mouth. We can see evidences of bruxism, which is really another term for grinding. But many times people are not aware of the fact that they are actually grinding their teeth. I remember specifically this older man that was coming from Africa. And when I did his exam and told him that he was grinding, he said, "No, I don't." But it was so evident because it has been so prolonged and it was so severe that his teeth were so flattened. You could really see it without the shadow of a doubt on the x-ray. And no matter how much I explained the fact that they did grind their teeth at night, they were just like, you know, affirming that no, they did not grind their teeth at night. Nevertheless, we did recommend treatment for the patient, but unfortunately, he had to go back to his home country. So anyway, what is really grinding? Grinding is when, or bruxism, is when people are actually wearing their teeth out by rubbing the teeth, the upper teeth with the lower teeth. And oftentimes it happens at night, which is the reason why I stated that, a spouse may be able to detect that problem while the person is not really aware of the fact that they're doing it. And also sometimes, they may also have bruxism happening during the day. But many, many, many times it actually occurs at night when the person is not aware that they're doing it. So, what causes people to grind their teeth? Um, the wearing of teeth is many times, often and most often, associated with severe stress, or with stress, right? The person is withstanding a lot of stress in their lives. I don't know if they have maybe problems in their workplace or problems in their family, and so they start grinding their teeth. They can also, in fact, clench their teeth, and clenching is where they just like, really chewing really hard on their teeth, and you can actually see the bulging of this muscle here, where when the person is actually clenching their teeth. Excuse me. And so, yes, that's when that happens, it's going to be wearing the teeth out. So many times it's associated with stress. Someone, as I said, is undergoing a lot of stress, and sometimes it could be maybe caused by the fact that your teeth are not well aligned. So you see some people, maybe like their teeth are not well positioned or crooked, as you say, and so you start seeing some grinding of some of the teeth, being evident on those particular people. It's very easy nowadays to actually show a patient proof of grinding by using a scanner, dental scanner, for example, the iTero, which we have in our office, because you can actually show the patient the tooth wear based on, the view that you show them, and it's more evident that way, and they can see, oh, okay, that this is what is happening, because they may not necessarily see what you're seeing on the x-rays, right? So grinding, what are the problems that they can actually cause, right? When somebody grinds their teeth, it can create some problems in their or structures of function. So they can have, as we said, wearing of teeth, where the teeth are becoming more flattened. It can cause sensitivity on their teeth. It actually also cause fracture of their teeth, or cracking of their teeth. It can also create recession, like gingival recession, or even sometimes, you start having not only recession, but mobility of your teeth, because you're applying so much pressure on your teeth. Okay, so those are some of the problems that can be done. So what are some of the treatments that can be actually done in order to address grinding? Well, it depends on the cause. I mean, it depends on what we are seeing. Say, for example, if you will see that you have some teeth that are cracked, you may be prescribed, or you may be offered a treatment of maybe having fillings or maybe crowns, depending on the problems. And sometimes, if the tooth is cracked so severely, perhaps you would be able to have a root canal to address the problem, followed by a crown. Okay, if the effect is on your temporomandibular junction, which is this articulation here that actually allows your mandible, which is your jaw, to be in function with your skull. In that sense, then we can have those kind of treatment being given to you. It may vary from medication or therapy, or sometimes, you may need even surgeries in most cases. So those are some of the things that can be done. But many times we actually prescribe a night guard or an occlusal guard that is going to be specific to your own teeth. Okay, and what is that going to cause, or what is that going to be, what is that going to prevent, is going to not necessarily prevent the fact that you're boxing your teeth or that you're grinding or clenching, but it's actually going to prevent the rubbing of those upper and those lower teeth together, further damaging those structures, and actually is going to create a buffer where the forces are also more distributed evenly across your teeth, so that the process of grinding your teeth is going to start decreasing. Okay, so that's something that is very beneficial to people. And in addition to a night guard, as we say, you may need therapy in order to add to the benefit of a night guard. Perhaps you would need medication changed if medications are what causes grinding, or maybe you will need therapy as far as addressing the TMJ problems, or even therapy as far as knowing how to manage your stress. Okay, so those are some of the things that can be done along line having a night guard. So that's what I wanted to talk to you about today. If you suspect that you're grinding, or if your spouse or your family members or friends are telling you that you grind your teeth because they can hear noises at night, don't hesitate to go and visit a dentist. If you don't have a dentist that you currently see, you can come to us and we will be able to assess the problem and steer you accordingly. You can give us a call at 972-213-0202, or you can secure an appointment by going to our website, www.healingwingsdental.com. And we are Healing Wings Dental. I'm Dr. Valerie Mukanga. It's the place where we help our patient maintain and regain their oral health and smile so that they can smile in life. We are located at 4101 West Green Oaks Boulevard in Arlington, Texas, and our zip code is 76016. We are located in the big metroplex of Dallas-Fort Worth. If you have found this information to be pertinent, please do not hesitate to share it with your friends and family, or whoever you know that you suspect may have that problem of bruxing their teeth. Or if you hear anything about that kind of problem, you can stir them our way. Okay, and so also, please, we would like to ask you to subscribe to our channel, whether YouTube channel, or actually like our post, or join us on Facebook, on Instagram, or even on LinkedIn, so you can find more information that pertains to your dental needs. And if you have a question to ask us, don't hesitate to ask your questions, and we will do our best to answer your questions and whatnot, maybe make a video in order to address your concerns. All right. That being said, I wish you a great day. Be blessed, and we'll see you next time. Bye bye.